Friday can come on now. It's your turn.
It's Friday now.
Anybody call Saturday here?
Thank you. I work with Channels TV. I would like to ask two questions. The first one is our insistence on self-isolation. You use the expression that we have witnessed influx of imported cases. Of course, the 12 cases were imported. Why are we still insisting on self-isolation as against what some other countries are doing? For instance, our sister country, Uganda, they are not practicing self-isolation. It is compulsory. If you are coming from any of those high-risk countries, it is compulsory that you will be isolated and you will pay the cost of the isolation. That is their own style. So why are we insisting on self-isolation, considering the kind of people we are, with all due respect to all of us? And then the second one has to do with our isolation centers. How many isolation centers do we actually have, and what is their capacity? How many suspected cases can they really accommodate? Thank you.
Yes, my name is Fred. I work with Sun River. Just yesterday, World Health Organization raised the alarm that we are getting to a point that we are having community transmission. Understand? They mentioned 12 countries specifically having the case of community transmission, and the spread is becoming so alarming that government needs to sit up as regards containment. My question now is, Honourable Minister, have we reached to that point of community transmission? Thank you.
Good afternoon, Honourable Minister. My name is Ogom from AIT. Quickly, I want to find out what's the cost for a testing kit? And secondly, why don't we have a place, maybe a general hospital where we can go for tests? I'm saying this because yesterday we did an investigative inquiry, and what we got from the call center wasn't okay at all. First of all, the lady who received the call and told us that she's only considering us because the person in question came from Lagos. If not, she wouldn't have considered us at all, which wasn't right. And we went further to ask her, what do we do now that we are suspecting a case? She said, just put the person inside a room. Just keep the person in a room. For me, I don't think that was necessary. What she would have told us was either take this person to a general hospital or otherwise, but there was no information. So I believe that those manning these call centers are not well informed on what information to give out to the public. Thank you.
Okay, thank you. Let's answer those ones. With regard to the last question, we're not charging anybody for the testing kit, and we have not charged anyone to pay for the testing kit. But there's criteria to be tested, because these testing kits are scarce, they're expensive, and we are not going to expend it on anybody who comes and say, test me. That will not work, because no country can afford that. There's one country that wanted to test everybody, and very soon they discovered they had to abandon the idea. It's not possible, because they collected samples from everybody and sent them to the main laboratory, and very soon their test kits were gone, and they didn't get. But you see, you must fit certain criteria. First is that you must have been outside the country within the preceding 14 days, or even if it's 16 days, we'll accept. If you haven't been, then you are not eligible. Second is that you may have been in contact with somebody who has been, a close contact with somebody who has traveled within the preceding 14 days, and that person either has been tested or has not been tested or has tested that is positive. If you fit those criteria, yes, definitely you'll be invited to test. Otherwise, you have to stay in self-isolation. If you have traveled and you have no symptoms, and keep reporting. Immediately you have a symptom, you can call and say, I traveled within the last 2 weeks, I just came from abroad, and I'm not feeling well, and I'm feeling very sick, I have fever. Then immediately you will be given attention for testing. For the transmission, community transmission, yes, that's a high risk, and many countries are already suffering community transmission, which is why we in Nigeria, every country uses its own strategy. As you can imagine, it's foolish for one country to try and copy what the other one is doing. You are going to lose seriously. So we have our experts here, public health experts, and epidemiologists who know the way diseases are transmitted, who advise government, advise us. I myself am not an epidemiologist, on the best approach. Therefore, our strategy here, knowing that this condition of our health service is to be fast and aggressive in finding out any possible case that may have entered. That's why we insist on self-isolation, we insist on supervised isolation, and we do testing, and we do contact tracing, and admission of people who are positive immediately into treatment centers. The Ugandan style, where the Ugandans have developed their own based on their own peculiarities, their own needs, they will not copy us, and we will not copy them. We look at what each country is doing to see if we need to copy or if we need to borrow a leaf from it. But we are not taking hook, line, and sinker what one country has adopted, because everybody knows its challenge, everybody knows how the shoe fits. The question of self-isolation, I think, is very important. It's something that is critical for our own strategy, in that a person who comes in on an airplane from an infected country, and as it is now, over 160 countries have cases. We do not know if he's carried the infection or not. And our first priority is that if he's carrying it, then, and he has not manifested it, then he needs to be in a place where he has the least possibility of spreading it to others. If he is not infected, we also don't want to imprison him in an isolation center where he will be very uncomfortable, or he might not feel at home. Somebody is coming from a long journey, you lock him up. So we decide that he can go home, but understand clearly and cooperate with self-isolation. Now, if he shows any symptoms of being unwell, we immediately bring him in for testing, or rather we go and take sample and test, and if it's positive, we take him straight away into a treatment center. I think that answers your question.
Number of isolation centers.
Yes, the isolation centers. First of all, we have isolation centers for various kinds of other diseases. But for coronavirus, every country is scrambling to build isolation centers. You know that China built its own 1,000-bed center in 10 days. That's them. But every country is scrambling for that, and we are also doing our own part. We have our own strategy to increase beds and also to sometimes improvise if need be. There's a standard isolation center going on in Kwagwalada. There is one already in Lagos, a very sound one, which was inherited from the coronavirus, the Ebola virus case that came into Nigeria. So they are very stable. And there are other strategies we are immediately working upon to develop isolation centers if the need arises. We're working seriously on those ones, including requesting our teaching hospitals to immediately make wards available if the need arises. But I will say that no country is ready. There's no country that tells you they are ready, they were ready for corona. All countries are really adapting and moving, and it depends on how fast you move and how calculated your moves are, that you can be able to control the epidemic or the threat of epidemic.
Okay. My name is Femi Atoyebi. I write for Punch newspaper. Honorable Minister, let me take you back to the issue of isolation center. I want to ask, how involved is the federal government in setting up isolation centers for state government? Because some of the pictures we have seen coming from state governments, what they call isolation centers are pathetic sites. I want to know what federal government is doing in helping state government to set up isolation centers, especially in terms of equipping the place and identifying a site for it. And then my second question is, at what stage will Nigeria activate quarantining instead of self-isolation? Thank you, sir.
Okay, good afternoon, Honorable Minister. My name is Moses Emorinken from the Nation newspaper. Mine will also be a follow-up from some of my colleagues on self-isolation. I mean, it's too critical right now that we have to make it very, important for everybody coming into the country. But my question is, sometimes we assume that everybody belongs to a certain level of standard of living. I tell you that some people, even if they are coming from abroad, they don't live in environments that they can really effectively self-isolate. Some people live in face me, I face you, yes, even if they come from abroad. Some people live in a 2-bedroom flat and they have kids and have families together. So I want to know if we are going to beef up our strategy for self-isolation. If the government is going to be involved in creating, if at all, create some isolation centers where these people can stay instead of, being threat to some of their family members because they don't have enough room for that. I think that's all. Thank you, sir.
Onyebuchi, I work with this newspaper. The minister, I want to talk about the treatment being meted out to those who are on isolation. That's isolation centers. We had an incident of what happened in Enugu, and the family gave a press statement on what they thought was what the neglect on their mother. Such cases, if allowed to go without a government trying to put it to rest, might discourage some people. They may see those isolation centers as death caves, because I know how and what my question is, what standard are we trying to insist on for health workers or health officials that are to attend to those on isolation centers? Because sometimes you go there, some might starve to death. Some might not receive normal treatment because everybody is scared. Do we have any standard method of attending to them so that we can have it all around, so that people cannot suffer unnecessarily for this kind of situation?
Okay, well, thank you. I'll start from the last one. First of all, you must not imagine isolation centers to be prisons. When you say some are starved to death, Enugu has had only one case. And the other case we had was in Ekiti at the moment, and then Ogun State, Enugu, Ogun State, and Lagos. So when you say some, it looks as if you are generalizing, and that's not quite accurate. You must know that many countries are trying to adjust rapidly to this threat, trying to adjust rapidly. Now, I do commend the family of the case that came into Enugu for being proactive in noticing that their mother came from travel abroad and noticing she had a temperature and taking necessary step and to approach the government or the health authorities there. And they apparently used whatever they had at the moment. We didn't know about the kind of facility they had. And the focus at the time was, is this person positive for coronavirus or not? And once they established that it was not positive, they discharged the patient. What happened subsequently, we didn't know. But I will say that part of the task that the Presidential Task Force on Control of Coronavirus has taken up now is to urge states to have, even if temporary, isolation centers that will meet standards. That's part of what the task force is looking at, because as I say again, nobody is ready for it. The isolation centers we have in all states refer to other disease patterns which you cannot put coronavirus with. So you are creating practically a new infrastructure for this particular kind of problem. So while we really do sympathize with the family, if that is where it actually happened as we are reporting, we do believe that it's a learning moment for everybody to know what to do and to respond in this case. With regard to the self-isolation of persons, I have stated that the self-isolation is actually a social responsibility. I have said that it is the interest of the individual, it is in the interest of their family, it is in the interest of their neighborhood and the country for them to self-isolate and use any method. We are not going to inspect your house to find out. And in my statement, I did say that if anyone needs to self-isolate, they should, as much as possible, stay in one room. Completely do not take visitors, so that you limit the number of people that stand a risk of being infected. So that remains the social responsibility of the individual to find out how they can do their self-isolation in their own room. I also know people who have called me and said, there are many of us who live in my house, I don't want to endanger them. So they want to go and take hotel room. They went to go and rent a hotel room, small hotel room outside that they rented. Now I call that social responsibility, individual social responsibility, in that they don't want to endanger their family. So that's what that person did. But I also know that there are people who resist any kind of being taken to an isolation center. They resist, they don't want to go. So those ones can also take a hotel room if they cannot take the other option. Now, we have said that isolation centers, we have got plans. We have got plans to increase and build one. I mean, many of them. But that cannot be realized within the next months or years or year. So we are talking about how to deal with the situation now, as it is now. Isolation centers will spring up, you will see them. Testing centers will also spring up. But before that happens, we want to be in control of the epidemic now, at this stage. Now, anybody who's on isolation, supervised or self-supervised, is going to be observed by those who are empowered to do so, NCDC and Port Health Services. Once you are positive, you are taken to infectious disease hospital, you are said to be in quarantine because you are now under treatment or being observed. In some cases, people who are very uncooperative have been known to be taken by authorities to forced observation centers. If they are not compliant and they turn out to be a risk, they can be taken by force to a place where they are supervised until it proves that they are negative. Some countries do that. I think that's it for now.
This will be the last set of questions. Just 3 people.
The federal government will support states and in isolation centers. And many of the isolation centers you have in states were either not used for a long time, so they were not in use, or they were used for other disease patterns, like Lassa or whatever. So, and probably do not fit the needs of the present requirement.